How do you treat HPV warts on the perianal skin? Great. Modern treatment involves addressing both the warts and the viral load. What is viral load? These are the viruses that reside in the deeper layers of the skin, known as the germinative layer. They live there with a latent symbiosis because they don't cause disease. If you have immunosuppression, corticosteroids, disappointments, autoimmune disease, etc., the immunological surveillance of antibodies sweeps over these latent viruses, turning your HPV warts symptomatic. So what do? I treat them with a carbon dioxide laser, using local anesthesia and light sedation. We remove the warts. The trick is to remove up to the germinative layer. You must stop there, as this layer produces collagen and contains melanocytes, which you shouldn't destroy. Always use the laser parallel to the lesion, never frontal. Otherwise, you may create a scar or cause vitiligo, so experience is essential in treating this. And the viral load, high-resolution endoscopy, will determine if the viral load is significant. If it is, treat it with immunomodulators, ointments, creams for 40 days. If the lesion is very small and asymptomatic, sometimes just monitoring by a proctologist is enough. It's important not to forget to always perform an endoscopy to ensure there are no lesions inside the anal canal, and rarely in the rectal mucosa. HPV warts predominantly affect the skin. I have been performing this treatment for 20 years. Recently, we added the powerful new generation carbon dioxide laser and high-resolution endoscopy to our clinic. For gay men, it's important not to just use ointments. A proctologist who examines the anus of gay men, like a gynecologist for women, achieves good results both aesthetically and functionally. If you don't have a laser and don't perform endoscopy, don't make mistakes, like burning the area with corrosive ointments. Empathy with the gay anus is crucial.